My symptoms started probably around 2005, 2006 is when I first started to notice them, but it came on slowly. So it was probably around 2007 when I started to first think that something was seriously wrong. I was in my mid-20s at that point. There was concern that it might be Alzheimer's, and actually that was one of the first diagnoses that actually gave me, is thinking that was early onset Alzheimer's. Up until then, it was a general physician. They couldn't figure out what the problem was. They thought maybe it was ADHD, and so they put me on like Ritalin, Vyvanse, Adderall, Concerta, like all of that. And nothing seemed to help. From that first diagnosis, I was scared. I was worried because I was afraid that I was slowly declining and that it would get to the point that I would no longer be able to support my job. I worried what that would do for my marriage. I was scared to death. I would have nights that I was just crying, trying to figure out, like, what is this going to mean for me in 5 years from now? Where am I going to be? Will I remember anything? We didn't have a clear idea of exactly what it was. Once they thought it was the early onset Alzheimer's, eventually they moved away from that, and we still had no idea what could be causing this. And in the end, we got a number of interpretations of what it might be, and even got a Lyme's test done at the time, and it was the CDC one, the ELISA test, and that came back negative. So we thought, okay, that was our last ditch effort. We thought that was it. We ended up seeing a Lyme literate doctor that specialized in both the conventional treatment of antibiotics and also the natural side of things, the supplements. So we did that for about, I'd say it was about 10 to 12 months of heavy courses of antibiotics and all kinds of supplements. But I didn't see any changes in my symptoms at that time. So we reached out to the friend we know because she took her son to Invida, and all the other doctors at the Cleveland Clinic and everywhere basically said there's nothing more that we can do, and if we can't figure it out within the next week or two, your son's not going to live. And so they happened to do a spinal tap, and they found the Lyme's disease in there, and then that's when she started doing her own investigation. So we reached out to her, and she mentioned Invida, and that's when we started the process of looking at Invida and coming out here. I was just wondering if this was going to work. I mean, at this point, over 5 years of getting to where I was doubtful that anything could fix this. I got to the point of just accepting it, that at some point I was going to lose my job. Hopefully I maintain my marriage and my relationship, but that I might not get better. And so I just came to grips with that. So when I first came to Invita for that meeting, I thought they really definitely know what they're doing here. And they have a lot of different options. That if there is one place that could help me, it was going to be this place. They were very caring. Dr. Oertle walked me through everything. Definitely, he reviewed all my files and paperwork, which is very rare for a doctor to actually do, especially a couple years worth of history. Before, when you get treatment for some of the conventional type things, they're usually covered. Your standard antibiotics and that kind of stuff. But coming out here, we definitely had a conversation. We walked out of here and we actually just walked around Scottsdale for a while, just talking it through, thinking, how are we going to do this? And we thought, is it worth it? But at that time, we thought, well, what is the cost of not doing this? I realized that in a couple years from now, I'm not going to have my job. And so whatever the cost was from coming out here was less and paled in comparison to what it would cost us if we didn't at least try it. But that first day, they already talked us through what the program was going to be like and what course of treatments I was going to have. And so I started meeting all of the nurses, and everybody was great. Everybody was sympathetic, and they know what you're going through. So that was a huge relief. The actual environment here in Invida is very different than what you get at most places. Because a lot of times you're used to a hospital type scenario where you have your own bed, your own room, and basically isolated from everybody. But here, a lot of the rooms are very warm and inviting. You'll sit there with a bunch of other people, other patients that either have Lyme's or cancer. It really helps getting through it, the mental aspects of getting treatment. Invita had me on the IPAC treatment and all the other stuff that went along with it. It took a couple weeks. I would say about in the 4th week, they decided to change up my treatment and do some work on draining my lymph nodes and my spinal fluid. And it was at that time that I started feeling a lot better. My short-term memory is no longer an issue. My long-term memory is pretty close to being there. But the greatest benefit I have now is I'm able to do my job. I'm able to interact with people and still remember things. I'm no longer forgetting my best friends' names. What the treatment here at Invida really means for my personal relationships, and especially with my wife and my family, is that I no longer have that fear of what's going to happen to me, what's going to happen to those relationships. I feel like now my relationship is much stronger. It's not so much that my wife is a caretaker for me anymore, trying to manage things. We have a more personal relationship again, like we did when we were first married. That's a huge miracle for me, and especially now as we're thinking about having a family. Before, the concern was, can we have kids? Do we want to have kids? What happens if this is something that we can pass through? And now I have that relief that we can start a family that we wanted to have.